We're ready to start. Okay, so good morning, everyone. My name is Leticia de Lara, and I will be chairing today's meeting. The time is 10:04, and I want to welcome you all to the city of Murrieta. Thank you, the city, for hosting us today. It's a beautiful day and a beautiful facility, so thank you very much for making this available to us. Okay, I am going to, before I turn it over to do the roll call, I want to welcome a couple of new board members. We have joining us for the first time, Danielle Johnson. She is our Youth Action Board seat representative, so thank you.
Awesome.
Okay. And we're going to take care of you because this seat has previously been vacant, so we want to make sure that you stay with us, okay, and get your perspective and your input. We really value that. And we also have Daryl Fry. He is representing the public government, previously held by Aaron Edwards. So, Daryl, thank you. And I also want to announce and thank the members that have been reelected for their continued interest and service to the homelessness of our county. Dr. Ben-Yuri, he is not here today, but we want to announce that he has been reelected. We have Dr. Kendrick Davis, who is representing the public university system. And then myself, I'm representing the private business section. And also we have Angelina Coe representing the nonprofit victim services advocate. So I want to thank you all for continuing, again, for your continued service. So I'm going to now turn it over to Mariel, who will do roll call. Oh, before we do that, I do want to announce that Karen Roper, another one of our members, is attending via remotely, and she has satisfied the requirements for good cause, so she is joining us remotely. So, Mariel, back to you.
Thank you, thank you. Good morning, everyone. Lieutenant William Hutchinson.
Here.
For Supervisor Karen Spiegel, we have Debbie Rose.
Here.
For Dr. Matthew Chang, we have Marcus Cannon.
Good morning.
Good morning. Daryl Fry.
Here.
Leticia De Lara.
Here.
Dr. Charles Lee Johnson.
Happy to be here.
Awesome. And Carol Alba.
Here.
Anise Smith.
Here.
Good morning. Danielle Johnson.
Here.
Karen Roper.
Karen Roper. Good morning, everybody. I'm here.
Good morning, Karen. And Greg Rodriguez. Amazing. Thank you, everyone. We've established quorum.
Thank you. Okay, we will move on to the next item, and let's see, I was supposed to mention something else. Okay, everybody did do verbal confirmation, so we took care of that. Okay. Okay, next we'll move on to the consent items that are listed. 2.1, which are the minutes for the meeting for June 27th. Is there a motion to approve the consent items?
No motion.
Okay, we have a first and a second. All those in favor say aye.
Aye.
Are there any noes? Are there any abstentions?
I think I'm an abstention.
Okay, we have one abstention. It passes with one abstention. Thank you. We have the next item, which is public comments. So we will allow 2 minutes for any members of the public that would like to speak, starting with our remote public. Mariel, do we have any members of the public remotely that would like to speak?
No, I'm not seeing any on chat right now.
Okay, very good. Then we will move on to the in-person public. Is there any member of the public that would like to speak on an item that is not listed on the agenda, but is of interest to this body? Okay, very good. Then we will move on to the next item on the agenda, which is new business 4.0. The first item is 4.1, updated youth homelessness demonstration program budget. And I will turn this over to Amy Primrose, who will start off with a presentation, and then we will follow that with public comment and then board comment as well. Thank you, Amy.
Thank you. Good morning, Board of Governance members. Thank you for joining us today. My name is Amy Primrose Puente, and I'm a Senior Program Specialist at Housing and Workforce Solutions, COC, and I'm here to present the latest updates on the Youth Homelessness Demonstration Program budget. And I'll just back away from this microphone just a bit. A little background, in September 2023, Riverside County was awarded $7,487,462 through HUD's Youth Homelessness Demonstration Program to address youth homelessness in Riverside County. Excuse me. YHDP is a demonstration project, and I think that's important to note because YHDP is administered by HUD Special Needs Assistance Programs Office, which is different than our mainstream HUD COC program. And because it's a demonstration program, HUD has defined YHDP funding requirements with very prescriptive requirements and guidelines in an effort to gain better results. Currently, we're in the 7th round of YHDP. And this is the first round where HUD has implemented a 50-50 mandate, which means that 50% of our total award has to go to housing, and 50% of the total award, or no more than 50%, can go to supportive services. Initially, when we were creating the YHDP budget, we were advised to separate the admin cost, the 10% admin costs, and the 10% planning costs from the rest of the award, which would leave $6,112,433 left to calculate that 50-50 housing and 50 supportive services. However, following the Board of Governance meeting on June 27th, HUD informed us that we would need to put that 10% admin charge back into the budget because that would be used to calculate our 50% housing, 50% supportive services. However, following the Board of Governance meeting, the last one, June 27th, where we brought YHDP to you to approve, we had from June 27th to July 1st to get everything into eSnaps. So the Board of Governance graciously approved our budget, we put it into eSnaps, and then we were in, and now this is Thursday that our board approved it, and we had until Monday morning, because HUD's 3 hours ahead, to get everything into eSnaps. So it was a long weekend for our team. During this process, during the weekend, we became aware of this change, that this $600,000 had to be put back into the budget. So the 10% admin, the 10% planning charge comes to $6 million. Without it, comes to $6,112,433, and that is what was initially awarded. So infusing this additional funding back into the budget, the following 2 projects saw an increase. Moreno Valley College, the Joint Transitional Housing Rapid Rehousing Project, increased from $778,052.25 to $1,070,793. This increase, we made this increase to up our housing percentage. That was the first reason. The second reason was because it was also based on feedback that we received during the solicitation process from our stakeholders that this award may not be big enough to fund the project for 2 years. So we considered that, and so that was the first project that saw an increase. The second project that saw an increase was Transgender Health and Wellness Center. This project increased from $100,000 to $433,453. This change came about to ensure comprehensive coverage for the east end of the county. Transgender Health and Wellness Center has committed to serving all youth in addition to the LGBTQ+ individuals. So those are the two projects that saw an increase. The reason why these are the only two projects that did see an increase is because everything was already in eSnaps. The budgets were already created, and the admin charges had already been calculated, and this was a beneficial way to put that extra funding back into the budget. HUD has since requested additional budget adjustments. I told you that this process is very prescriptive, and I wasn't joking. They have a lot to say about too much in operations. They want us to move it. If we have, they had us move an entire operations budget because we had rental assistance and leasing, and so they wanted the operation, even though we did have rental assistance, they wanted it completely out of the budget. So there has been a lot of movement with these projects based on the recommendations from HUD before they will approve the projects. HUD has also informed, so another issue that we had was staff to client ratios, which mean that we had to slash our supportive services budget significantly to meet HUD's ratio requirements. But I think the most challenging, besides the 10% admin, the most challenging has been that HUD has informed us that the Moreno Valley College transitional housing and rapid rehousing project cannot operate as initially intended. So COC staff are working with the joint projects to address HUD's revisions and explore viable options. And so I do anticipate some more changes, so it's likely not the last time you'll see me before you today, or again. So we kindly ask the board to approve the revised budget presented today, which incorporates all of HUD's requested changes to date. Additionally, in our commitment to amplify youth voices, this revised budget has been reviewed and approved by our Youth Action Board members. So thank you for your consideration, and I'm happy to accept questions when the board's ready.
Very good. Thank you, Amy. And we will start with board comments, questions, and then we'll turn to the public for any comments from them. So do we have any board members that would like to address this item?
I have a question just around, so I'm assuming that there's been conversation as far as capacity for Transgender Health and Wellness Center. That's a significant increase, almost 4 times. Can you tell us just a little bit about what the conversation has been there as far as being ready to assume that type of responsibility? Absolutely. So that we're not returning money? And then maybe the nuances on the MVC, that was a very exciting piece that was written and, in review. So wondering what those changes potentially could be.
And Amy, I could jump in and help with those questions. So in regards to Transgender Health and Wellness, this is the second grant award that they are receiving under our HUD Continuum of Care program. So even though they're listed here for the first time, they have been operating a HUD Continuum of Care DV bonus project in partnership with Lighthouse Social Services, and just completed their first full year, and the project has done relatively well. With that said, we agreed and we noted the significant increase to the organization, and they recognize that because this is a 2-year grant awards, I think that's another thing to keep in mind, where it looks like a significant increase. Unlike our HUD COC program, this funding is really spread out over a 24-month period, so probably about $200,000 annually. But what I would want the board to know is that as part of our process and working with all of our subrecipients, we are meeting with them on a monthly basis. We have regular technical assistance calls where we meet to review and monitor billings that are coming in, but are also looking at project performance. Are they meeting the number of clients that they need to serve? And so that will be a key part to ensure that they can remain successful throughout this program. In regards to Moreno Valley Community College, Many of you were on the planning calls that we had for Youth Homelessness Demonstration Program, and it was during those calls that the TA providers from HUD encouraged us to partner with community colleges, and we were very, very much looking forward to that and mirroring other programs across the nation where community colleges provided housing to students enrolled in those projects. There must be some lessons learned that HUD is taking back from those projects that have operated on a national level, because the change now is that projects can no longer serve or limit enrollments to only students. In the same way that we had to go back to transgender health and wellness and ask them to be available to serve all young adults, the same conversations are currently being had with Moreno Valley Community College, which you can imagine is unique, right, for them. And so they're meeting with their board as we speak to try to figure out how to work out this challenge. Some of it may result in them subcontracting out with like another housing provider to meet the need for non-students, just kind of throwing out some of the ideas that we've considered. But to Amy's point, YHDP is a relatively newer program to HUD, and what we're seeing is that while this is the 7th round of funding that they have allocated, every year they're making very prescriptive changes that are causing these types of changes. What I will say on the last call that I was on with the HUD TAs is they said, actually, you guys have, in regards to our county, they have said you guys have had the least changes we've had to make across programs. You guys are doing relatively well. So I know what we presented to you sounds very confusing. There's, funding that's being moved around, but they did give us kudos and say you guys are doing much better than some of the other, newer COCs that we're trying to start up.
Okay. Dr. Johnson, you have more questions?
Yeah, so just a follow-up on that. So one of the things that I've been seeing just in my travels is that some of those programs have been underutilized, so they're not meeting capacity. And so just one of the things that I think that's sort of the kickback of what's here is that there's housing, there was a need, but that need's not being met, right? And so then it seems like resources are not correctly being used and people are fighting against that. So just for us to be vigilant, here within the county to be sure that we are going to meet capacity. And that's why my questions are sort of in the way. Anything that we can do as a board in order to ensure that those who are funded are able to successfully meet the numbers and to meet the targets, I think that's going to be very important and sort of why this type of thing is happening.
Thank you. And I see that Greg has a question, comment?
Yeah, I just want to reiterate something that Tanya said about that we're actually been much more proactive with our partners in order to make sure that those funds are being expended. We've had many conversations over the years that we don't want money left on the table. And again, those monthly TA calls have really helped to do that. So,
thank you, Greg. Any other members of the board have questions?
Yeah, good question.
Yes.
For one, kudos to you, Amy. To the county, to the team. It does sound like you had a busy weekend trying to kind of align with
a few of them.
HUD rules and all the different, requirements. So this, as a begin, just kudos to you. It sounds like going to the Moreno Valley College project, again, you stated kind of there are, HUD doesn't accept it as is, right?
Right.
So there's going to be some revisions needed. So can you kind of just walk us through, I guess, the process of working with Moreno Valley College and getting it up to standard? And then secondly, kind of going to the concern of that you shared regarding Moreno Valley College serving not just the students, but also community at large. Can you share if there's any concerns from the Mobile College staff that we might need to be aware of?
Absolutely. We met with Moreno Valley, when we received word, we immediately met with Moreno Valley College. We met with them on September 5th. And we met with their leadership and for their housing program. And we told them HUD's feedback, and their number one concern was that they are an educational institution and they're not equipped to to serve everybody, right? So we explored partnerships, different partnerships that they could enter into so that they could still be the awardee and still serve the demographic of folks they want to serve, but they could give all the other referrals to their subcontractor, which would be a housing provider. We had a housing provider in mind. We reached out to them. They were willing to explore the option. They were actually excited about it. But the problem with Moreno Valley College that they expressed was that they couldn't be the awardee because they can't funnel those dollars through their institution to pay for other non-students. So they requested 2 weeks to meet with their cabinet and to review everything and see if they had any wiggle room or there was any adjustments they could make at their institutional level. And we're waiting to hear back from them now. So they're trying to see how they can make it work right now. And they are going to provide us a formal answer on October 8th.
Again, continual push and encouragement for the county team. It's a lot of work.
Thank you.
Housing provider, can you share the name for that
Sure.
organization?
Path of Life.
Path of Life.
There are other joint program.
Any other questions, Daryl? No? Okay.
Yes.
Any other?
Madam Chair?
Hold on, Karen. Okay, you're on.
Thank you. Amy, I just wanted to say how proud I am of you and the whole team. I know this is a whole new initiative, and you guys spent so much time through the whole planning process and then going through this RFP and funding allocation process. And it's interesting to see the feedback that we're getting from HUD. And, I wanted to encourage you to remember, they say for every vision in this space, there is revision, right? So we just want you to know that we're here to support you. We're really proud of the great work that's going to be happening. And I cannot wait to see these programs launched throughout the region because it is so desperately needed for the TAY population and our youth population. So I just wanted to congratulate you guys for all of the hard work and especially for being so nimble to get these updates done so quickly with the providers.
Thank you, Madam Chair.
Very well said. Thank you, Karen. Dr. Johnson.
Yeah, I have one follow-up then on that. So then what will be the contingency plan should they return on the 8th and state that they're not able to take the funding?
It's a great question. We have a very promising. Yeah, we actually have a very promising proposal that was submitted along during the solicitation process for these funds. We have a very promising proposal that Daughters of Love.
Okay.
That's the agency.
I know Daughters of Love. That would be exciting. How are the other partnerships working with community colleges then nationally? I thought one of the things that was exciting here was that there's a community college at the table. So just an exciting part of what was being provided here and certainly a big need. How are those other partnerships working to where they're able to make it happen and maybe we're sort of hitting a roadblock?
Well, the feedback that we received from the HUD TA is that the colleges that are willing to run these programs have opened it up to where they're serving everybody.
Yeah. Or in other cases, the colleges are really serving as an access point and referring students who are experiencing homelessness to housing assistance programs funded through YHDP.
Yes, Anise.
Thank you, Amy. Thank you for all your hard work and the weekends and staying on top of all of this with last-minute changes from HUD. I did have a question regarding, you brought up a challenge concerning staff-to-client ratios.
Yes.
So I am curious about that, if the organizations that are receiving the funding are having trouble recruiting, what ideas have kind of been tossed around about how to address that? Because certainly that is a roadblock to being able to provide the services they're trying to provide if nobody is, I don't know if people aren't applying, but certainly if people aren't applying, or for whatever reason, how do we make these jobs more attractive so that we can get more people and serve our clients better?
Well, I have some ideas about that, Anise, but the client to staff ratio, that's not the issue. The issue is they want the supportive services budget slashed. So you get, for our joint programs, the client to staff ratio is 1:15. So, and they're very strict on that. And so you cannot have any more than, so there was a lot of, because the supportive services budgets were not, I didn't think that they were heavy to begin with, right? I thought that I thought that it was probably what needed to run a program. But I mean, literally in our supportive services budgets, and many of them, it's like one person. I mean, it's just they wanted it very, very, as thin as we could possibly get it. If we were under one person, let's say that they said, for instance, they'd serve 14 people. Well, you either have to up that one, serve an additional person, and we raised it as much as we could to the agency's capacity. But it was tricky. And agencies, as you could imagine, weren't happy to be losing staff. And we did write one justification for Path of Life Ministries when it was not approved. Did I answer your question?
Okay. Thank you. Any other members of the board have any questions or comments? I do have a comment before I open it up to public comments. Karen, do you have any other further questions, comments?
No, thank you, Madam Chair.
Okay. The admin costs, what is the amount that is being allowed by HUD?
10%.
Okay.
And did you want the total amount? 600, that is oh no. That is.
It's 10% of the total.
It's 10%. It's,
Okay.
I have it on another paper.
Oh, it's okay. It's okay. It's okay. That's a good number.
It's about 600,000.
Okay.
It's a little over 600,000.
Thank you.
You're welcome.
Okay. Is there any member of the public that have any comments from remotely? Do we have any? No? Okay. How about in person? Do we have any members of the public here that would like to comment or have a question about this item? Okay. There are none. I'm following back up to the board. Anything that any other further comments, questions? There being none, there is a recommended motion on the floor. Is there any member that would like to make a motion?
Make the motion that we approve the updated program budget, increasing by 600,000 or so for a total amount of what is printed on our paper.
Correct.
Second.
We have a first and a second. We'll do roll call since we do have a member remotely.
Lieutenant William Hutchinson,
Yes.
Debbie Rose,
Yes.
Marcus Cannon,
Yes.
Daryl Fry,
Yes.
Leticia DeLara,
Yes.
Dr. Charles Lee Johnson,
Yes.
Carol Alba,
Yes.
Anise Smith,
Yes.
Daniel Johnson,
Yes.
and Karen Rupper.
Yes.
It is unanimous. We will move on to the next item, which is 4.2, the 2024 HUD Continuum of Care Program Funding Recommendations, and I will turn this over to Tanya.
Thank you, and good morning, board, all of our membership body who is with us today, both here in person and those of you that are attending virtually. Tanya Torno, Deputy Director with Riverside County's Housing and Workforce Solutions Department, and I have the pleasure in speaking to you on item 4.2, HUD Continuum of Care Funding Recommendations. And every year, we come and review funding recommendations that are made for this program. We did this last year around the same time. This year, HUD released the Continuum of Care NOFO on August 8th. And what I would want you to know about this grant application process, if you are new, is that it essentially includes two main pieces. So the first being a narrative section that our team completes in partnership with our membership body, our partners through CES, and of course our team in HMIS to provide responses to questions which measure our system performance, compliance with fair housing, coordinated entry system, and our homeless management information system, reporting requirements, our use of leveraging other funds, and commitments to Housing First, harm reduction, and trauma-informed care, to name a few. The other portion of the application, which is what we'll be reviewing with each of you today, is commitments to the funding that is allocated to us each year from HUD. So this year, part of our annual renewal demand, which is designated to our continuum of care, equals to $14.7 million. The full amount is included in the background section on the agenda. And we have the ability to go after additional bonus dollars that are very, very competitive. And in the past, we have been able to secure some funding, but again, these are dollars that HUD does not entirely commit to a continuum. It is important to note that COCs, including ours, use the ARD, so that $14.7 million, to support existing projects, which are providing permanent supportive housing and rapid rehousing to clients. COCs can, and we do, as part of our annual renewal process, review performance of each of those projects to determine whether their funding should be renewed or whether it should be reallocated. So in cases where there is a project that has a lower performance score, maybe they're not serving the number of clients that is spelled out in their contract, maybe they're not spending down at the rate that they should, right? These are some of the reasons why you as the board, our continuum of care, would consider reallocating funding towards another or new project. It's important to note that currently we have a total of, I believe it's 18, and why am I questioning myself? 19, that's why I questioned myself. I was one short. 19 existing projects that received funding were approved by this board and are currently assisting clients. So they are paying subsidies on those clients. Those are clients that are in housing and being well taken care of. Together, these projects make up 904 beds and 583 units across our entire county. And in the event that a COC or we ever decide to reallocate any of those projects, it would be really important to consider the impact of loss to housing to those individuals, which of course we would work to prevent, and in the past have coordinated a transition plan to make sure that clients do not lose the housing that they are receiving. It's kind of fun to hear my echo. I don't sound like that, right? Just kidding. So moving forward, our staff worked closely with the Continuum of Care to recruit an independent review panel. So a group of members from the COC who reviewed, scored, and looked at the project performance of all of our renewal applications, in addition to new applications that were received for our bonus projects. Altogether, as part of a bid application that we released, we received a total of 33 applications, which is amazing, which is great, which again speaks to everyone's eagerness to do more, but also recognizing the need that we need to do more to be able to end homelessness. So based on our evaluation with the independent review panel, what I want you to know is that the independent review panel has agreed or selected to renew all existing projects, and that's because all of those projects are meeting and carrying out the programs and serving clients well. So on the list in front of you that's printed on the agenda, items ranking 1 through 19 are all before you to be renewed. Additionally, for the COC and DV bonus projects, there are 5 new projects being recommended for funding. Starting with the COC bonus, and we have a total amount available of $2.1 million. The independent review panel is recommending that Lighthouse Social Service, that Illumination Foundation, Path of Life Ministries, and RUHS Behavioral Health, so numbers 20 to 22, all be included in our application to HUD. And you will see, I think the important note here is that all of these projects are supporting permanent supportive housing units. Permanent supportive housing is unique because these are projects that attract services to chronically homeless individuals, those that have experienced longer lengths of homelessness and have a disability and need ongoing supports to maintain that assistance. On our current by name list, there are over 600 individuals who are chronically homeless and are waiting for a PSH bed. So these beds would meet a critical need. Secondly, for the DV bonus projects, the independent review panel is recommending that his daughter's house be funded to support 2 separate projects, a rapid rehousing transitional housing project and a full rapid rehousing project. Essentially, these are projects that would provide temporary rental assistance, move-in assistance to families who are fleeing domestic violence and need temporary supports to be able to become independent and then graduate off those programs towards self-sufficiency. So with that said, the hardest part of our job, I think everyone here, I'm not just speaking about my job, but the role that we play within the continuum of care is recognizing the big need that we have. And later today, you're going to be hearing from Salam Walker, our research specialist, who is going to talk about the impact of this continuum of care, but certainly speak to the ongoing need for more housing. So it never feels good to have to turn away or not fund full applications. And in fact, if we had more resources, this would have looked very differently. We would have funded all 33 applications that met the criteria. Once again, the projects that are being recommended for funding are before you today. There is another part of the process that I will briefly explain. Because HUD wants COCs to do just what Dr. Lee mentioned earlier, remain competitive and be held accountable, they require COCs to rank these projects in Tier 1 and into Tier 2. Your Tier 1 projects are pretty much guaranteed to be funded. So 90% of our funding falls within Tier 1, and HUD is saying those should be your top projects. And then your Tier 2, right, there's always this risk of those dollars being lost, are projects that would have essentially scored lower or were prioritized lower based on our priorities spelled out in our homeless action plan. So that is the reason why you'll see that there's a Tier 1 and there's a Tier 2. We have reached out to all of the agencies to notify those who are receiving funding and those who have not been recommended for funding, in addition to those that have fallen in Tier 1 and those who have fallen in Tier 2. I can confidently say that in the last 6 years that I have been a part of the continuum of care, we have not lost funding towards our Tier 2 projects. Right, we've been very fortunate, and HUD has continued to fulfill its commitment. So with that said, we'll go ahead and open it up to see if anybody has any questions.
Thank you, Tanya. Okay, board members, are there any members of the board that have any questions, comments on this item? Okay, and go ahead, Maria.
We have Karen with her hand up in the chat.
I was going to ask you next, so she beat me to the punch. Karen, please proceed.
Thank you so much, Madam Chair. Tanya, good job. I do have a question. HUD still has performance metrics that you also have to report on behalf of our county. Is that correct? And I know sometimes they're a moving target, but I think it has to do with things like unearned income or length of stay, or how we're doing with discharge planning, really how we're functioning and performing as a system. And I feel it's really important for us as a board to be discussing those metrics and see how they align with our homeless action plan. And I know that you guys have to update, you have to put that information, I think, in eSnaps, but it's summarized when we save the application. But I'm just wondering if we're not prepared to talk about it today, if we could have the opportunity to see what those performance metrics were that we're communicating to HUD as part of this application.
Mm-hmm. Okay, thank you, Karen. And Tanya, I'll let you respond to that.
Yes, I spoke a little bit about those performance metrics without going into detail when I started, and Karen, I love your idea. I'm happy to add that to our next month's meeting agenda and prepare a full report out on those measures and share our responses. You should also know that when we complete the application, we do upload that onto our website. It is emailed to the entire continuum of care for full transparency. I think we even emailed the draft out to the COC so they can provide feedback. And there's a lot of you that have provided us with language to add to strengthen our application and to speak to our performance. But happy to do that, and we'll make sure that we're prepared to do so.
Thank you, Karen, for those ideas, and thank you, Tanya. Any other comments, questions, Karen?
No, thank you, Madam Chair.
Okay. Any other questions? Yes, starting with Carol, followed by Anise. Okay, Carol.
You're just helping me.
Okay.
My question is, how are the smaller nonprofits represented in these recommendations?
Yeah, so what we did this year in our application is we actually provided additional points to agencies that were contracting out with newer organizations, in addition to those that were working with entities like our healthcare system and our housing authority to leverage additional resources to build capacity. So I know that was certainly something that was incentivized throughout the process. In regards to smaller organizations, and those that are represented here, I know that, and I believe Dr. Mason is here with his daughter's house, but they are definitely one of the newer organizations that we have funded through the HUD Continuum of Care. And so we're excited about being able to bring them on in full force, because in past years, we really relied on them to help us take over, for lack of a better term, like take over some of the projects that weren't performing. And they have really proven themselves through that process, not only in meeting the number of clients to be served, but really carrying out good care. And to Karen's point about performance outcomes, their projects speak to that. The clients that they have assisted have exited to permanent housing and maintained that housing at really, really high rates. The other piece, and I just think it's important to know, and we've talked about this at previous Board of Governance meetings, is just around the difficulty in really administering HUD Continuum of Care projects. I think any of our subrecipients can really attest to how challenging it can be to operate a HUD program, because they're not as flexible as HAP funding, which really allow you to not have limitations around staffing ratios or supportive service costs, but also can allow you to sort of move clients around in a project at more or greater frequency than HUD COC, which is, again, these are very specific terms. You have 12 months. If the money doesn't get spent, you lose it, and the next day is a new day, and we're starting all over. So I think that Carol and the rest of the board, as you have seen, we have really been intentional about encouraging newer subrecipients, in addition to partnering, looking at our state funding, like HAP Round 4, which we currently have available, and through a bid application process for newer agencies to apply and build their capacity in that way so that they are more prepared and successful ultimately when taking on a HUD Continuum of Care project.
Thank you. Carol, you have follow-up?
Well, let me rephrase the question. Sorry. Of the recommended projects that are here, the 19, or it looks like 19, how many of them partnered with smaller agencies? That's my question.
Well, I know, so we would have to come back. I mean, I don't have that level of detail, but I'm happy to. I do know that a lot of these subrecipients partner with the larger community, and they work with different providers in a different way, but I'm happy to do a deeper dive and then report that out at the next Board of Governance meeting. But certainly if there are any subrecipients that are on the line, I know we encourage them to be here today, that maybe can talk about how they're partnering with other nonprofit organizations. We would welcome that.
And I'm asking pointed questions like this because my role on this board is to represent the smaller nonprofit agencies. So just to let you know why I'm asking those questions.
Very good. Thank you, Carol. Any other member of the board? Karen, you have a question?
Yeah, just a comment to follow up on Carol's question. One thing that might be able to happen once the approval has taken place and the programs are launched is the opportunity for the funded agencies to look at collaboration with the smaller organizations in terms of sharing clients and working together. So that might be an opportunity. I don't think there's anything that would prohibit that type of partnership from happening. So just a thought, Carol, if there's small organizations, your organization or others, that might be an opportunity. Tanya, I don't know what you think about that, but it seems like some interagency MOUs would be easy to do in terms of client referrals and building relationships, right?
Yes.
I know we have another hand raised, but I would definitely stress that I know a lot of our subrecipients are partnering with a range of organizations.
Okay, I missed that hand. Who raised their hand?
Madam Chair.
Is that a member of the public?
Yeah, we
Okay,
have,
hold on, please. Oh, okay.
This is Sonia Lamas. I'm a voting member.
Okay, then go ahead, please.
Hello. Yes, hi, good morning, everybody, and thank you for having this space today. I just kind of wanted to piggyback on the collaboration on smaller organizations, right? For myself, and our organization and our teams, slowly we've been growing into that space. Recently, we did and we work with various other organizations. I think that in the most recent year and a half, maybe 2 years, there's been a very strong encouragement for the collaboration part of, applying for grants. Before that, I think it was more everybody was kind of trying to figure things on their own. We know what it feels like to get a letter of regret, right, on a project that, was pretty feasible. But again, we're a newer organization and we're not experienced. So we definitely respect, those factors. But however, I think it's important that we continue to collaborate. And if we don't ask or if we don't reach out to those partners or, continue to collab in the space of like community, partnerships, then we won't have an opportunity, right? But I just wanted to just really, kind of, like I said, reinforce that because it is happening. We are in collaboration with various different organizations right now, and it's, it's on a referral basis. So I just kind of wanted to give kudos to that.
Thank you, Sonia, for your comments and for starting us off with public comments. So we will then open it up to additional public comments remotely. Do we have anybody?
Yes, we have Jamie.
Jamie, go ahead, please.
Hi, everyone. Jamie Goodner. I'm one of the senior program specialists with the Continuum Care. I just wanted to make a comment to this group in regards to what Tanya's been speaking of regarding funding recommendations. And I know the board and members have kind of made comments about the projects moving forward and project implementation. And I just wanted to re-emphasize that these are funding recommendations and that they are solely being accepted to be included in our consolidated application. And the final step is going to be for HUD's actual approval of these projects that we're considering funding. So I just wanted to kind of re-emphasize that. That right now, this does not mean that they've actually been awarded the funds, but that they are included on our consolidated application, which then HUD will make that final determination somewhere in the beginning of 2025.
Okay, thank you. And yes, we do hope that they will approve every one of our recommendations. Do we have any additional members of the public remotely? Okay, then I will ask any members of the public here today that would like to come up, introduce themselves, and have a question or comment on this item. There are, oh, yes, please come forward.
Hi, everyone.
Hold on, please. Hold on, please. We have somebody ahead of you, and then I will call on you next, okay? Please? Thank you.
Good morning, Council. So at Jewish Family Services, we sincerely are grateful for the longstanding partnership we've had with the county, especially working with the Department of Housing and Workforce Solutions staff. This partnership allows local agencies to provide critical services to individuals and families experiencing homelessness. The COC's independent review panel recommended the funding for one of our projects, Desert Rose Permanent Supportive Housing, to be split between Tier 1 and Tier 2. Therefore, it's being recommended that it's to be fully funded. We are deeply concerned on how the scores in the ranking system was applied. First, there was an agency that scored lower in annual performance than Jewish Family Services, but was ranked higher and is recommended to be fully funded. While a footnote indicates the lower score was due to billing challenges, COC should provide clear guidance on performance issues versus billing issues or data entry issues, especially if the raw project score is not uniformly applied in determining the rankings. Secondly, the performance score does not equitably consider the different types of projects. The Desert Rose score was 91% due to one data error and cost effectiveness of the program. This project is a PSH master leasing program, which always has cost. More because it includes its operations budgets, unlike rapid rehousing programs of the PSH rental assistance. Eligible expenses under operations include staffing for maintenance, relocations and inspections, insurance for client units, furnishings, and equipment, such as appliances, utilities for client units, pest control services, and supplies for unit repairs. The RFP offered bonus points for PSH projects, master leasing projects, new partnerships with agencies that do not have COC fundings. JFS included all of these in our budget. We're asking that the Desert Rose project score be reevaluated and re-ranked. If HUD does not award Tier 2, the COC would lose more than 20 PSH units in the Palm Springs area, which provides at least to 20 different individuals and their dependents. This is not just a loss of housing, but also the full spectrum of client services we provide that create long-term stability and security. We are grateful for your ongoing support and partnership, and we thank you for the opportunity to provide public comment today.
Thank you very much for your comments. I'm going to turn it over to Tanya to respond.
Yes, so I'm just want to make sure that I.
Can I jump in?
Sure, jump in.
So I worked closely with our COC consultant on the review and ranking, and where this project lies is not a reflection of the project performance or the score, but more so a strategy as a whole for the COC. Based on how HUD ranks COCs, looks at projects, and how Tier 1 and Tier 2 differ in terms of competition on a national level. So we were looking for a straddle project that met the criteria of having 50% of the total amount, the total dollar value of the project in Tier 1 and 50% in Tier 2 in order to avoid having one project that was initially a fairly large project, the second largest project in our COC, be at risk of completely being defunded and those funds being removed from our community as a whole. And so it was not a reflection of the project itself. Your application scored very well. It was more of a strategy, again, for the COC, for our community as a whole. To date, we have not had projects in Tier 2 not be funded, with the exception of transitional housing projects, because HUD did away with funding those projects. So we feel very confident that the project is not at risk of being defunded, but it was really a strategy. So what happens in Tier 1, HUD takes the entire Tier 1 block and we compete as the COC with other COCs. In Tier 2, there's a change in the formula. And so you're competing project by project across the entire nation. So part of it is the 50-50 split. The other part is that the total dollar value in Tier 2 can cost our COC application significant amount of points. So we want to, as a strategy, have the least amount total in Tier 2 dollar value to increase the number of points that are allocated to our COC. So it really was a strategy move, if you will, to have that one project be straddling Tier 1 and Tier 2.
Okay, thank you, Emma, for that explanation. Do you have any follow-up questions?
I do not at this time.
Okay, thank you very much for attending today and for bringing this up and for giving us an opportunity to have a better understanding of the process.
Thank you, Madam Chair.
Okay, I'm asking the board members if they have any other questions or comments. Okay, there was one person remotely that had wanted to speak. If we could turn back over to that person.
Yes, we had Young Mi Garcia. I'm not sure if her hand went down, though.
Okay, so there are no other public comments on this item. Is there a member of the board that would like to move forward with the recommendation as a motion?
Motion to approve.
We have Karen making the motion as recommended. Before we do that, actually, though, we do have several of these applications that it appears that there's a potential conflict of interest. Should we pull those separately and have two motions? Or are we just going to have the abstain, so they would abstain except for those items? Okay, so we have a motion on the floor to move the recommended motion as stated to approve the ranking and tiering recommendations for the COC renewal, COC bonus, and DV bonus project applications to be included in the Riverside County's HUD COC competition application. Is there a second?
I'll second.
Okay, we have a first and a second. Okay, and we're going to call by roll call. Okay, and
Thank you. And just for the record, could I get who seconded the motion? William?
Yeah, Lieutenant Hutchinson.
Lieutenant Hutchinson.
All right. Lieutenant William Hutchinson? Yep. And
Correct.
Debbie Rose?
Yes.
Marcus Cannon?
Abstain.
Leticia DeLara?
Yes.
Dr. Charles Lee Johnson?
Yes.
Carol Alba? Yes. Anise Smith?
Yes.
Danielle Johnson? Yes. Karen Rupper?
It's 20 million. I'm enthusiastically yes.
Thank you. And Daryl Fry.
Yes.
Thank you.
The item passes. We will move on to the next item, which is 4.3, the 2025 point-in-time count. I will turn this item over to Tanya.
It's that time. We are preparing for our biannual point-in-time count. In 2023, we agreed to begin moving the count to every other year, recognizing the great amount of resources, both, as Greg says, in human capital, but in also, monetary, just pulling together the resources to do the count are a heavy lift. But nonetheless, you will never hear us say that we don't like data. We recognize the need to be able to measure and meet HUD's requirements for capturing a snapshot of who is experiencing homelessness in our community. So for those of you that are new, HUD requires continuums of care to facilitate an unsheltered count at least every other year, and a sheltered count every year. The unsheltered count consists of recruiting volunteers and working with our different partners to physically go out and identify and count, identify, survey, and count people who are experiencing homelessness. And we do that working very, very closely with all of our cities. As long as I've been a part of the COC, every single city has participated in the count. And we also work very closely with our county sheriff's department and other partners within the HOPE team to go out and count the unincorporated areas of the county. For our sheltered count, because most of our sheltered data is tracked in HMIS, our data and research team work closely with those entities to make sure that their information is up to date so we can get a full census of who is in shelter, while also encouraging shelters who maybe don't enter their data into HMIS but are willing to share their data with us so that we have a really good picture of who is experiencing homelessness. So what I wanted to share today is that planning efforts are underway, and there are 4 community planning meetings that each of you will be encouraged to participate in, the first being October 29th from 3 to 4. And all of you should have received a calendar appointment because your COC chair, Karen Roper, made sure of it. She emailed us and said, don't just send an email, let's make sure that we get good participation and make sure that people reserve these dates on their calendar. In addition to the count, I think the one venture we're always excited to carry out on the day is our More Than a Count initiative. And this year we're going to be partnering with VA Loma Linda and all of our veteran service providers, US Vets, Lighthouse Social Services, who receive SSVF funding, in addition to the Housing Authority, and of course all of our different outreach teams, all of you, anyone and everyone who wants to participate, so that any veteran who is identified on the day of the count can be quickly transported to one of multiple access sites and be screened for housing and services. And I left out County Veteran Services, and if Greg Kofos is here, I apologize. They are a key player as a result of an investment the Board of Governance approved to them to support a homeless coordinator position. We're very proud of how our methodology to conduct the count. We use a mobile app in partnership with Esri, and I have to give kudos to our county IT team who are really involved in that process. And so if we advance to the next slide, I always have a tendency to get ahead of myself. I talked about the sheltered count, the unsheltered count. If we advance once more, we have a couple of planning activities. So in addition to the 4 meetings that are up and coming, we definitely want to raise as much awareness about this event. This is definitely one of the ways that we can build or bring in community partners, faith-based organizations to join us and really understand the impact of homelessness. And so we are looking forward to doing as many presentations as we can to different community groups. And so we encourage all of you, if you have a particular interest in helping us identify which groups to present to, or if you'd like to help us facilitate a presentation, we'd be happy to loop you in. You can also assist us with reviewing the survey tool that we use and the questions that we ask. There is a methodology that HUD releases year to year, and so I think we're expecting for that guidance to be released the first week of November. That will inform us if HUD has any additional reporting requirements that they want us to capture. But locally, we have made additional enhancements to that process. Greg Rodriguez from our team in the past has increased our ability to capture managed care plan information so we can quickly measure if folks are connected in that way. We're also going to be working with cities to identify deployment sites. And so these are sites where volunteers who are going out to count would report to on the day of and be assigned to the areas that they would be covering. And then, of course, we work closely with agencies who serve as main access points. So if you think about our food pantries and the Department of Public Social Services, sort of their self-sufficiency offices where you have a lot of individuals who are homeless and are coming in to obtain services. We work with those agencies to count people there too, so no one is missed. And then I talked about the Veterans Initiative, which we're really looking forward to. And I think this might be it if we advance one more time. That might be a wrap. So with that, I'll just open it up to see if anybody has any questions. We're really looking forward to this year's count, and to our cities that are on the line, we appreciate you, and you'll be hearing from me soon. Thank you.
Very good. I'm sure we do have comments and questions from board members, starting with board comments and questions on the presentation. Maybe I was wrong. Okay, how about from the public? Oh, yes, Marcus.
That's just slow on the draw.
Okay.
Thank you. Just wanted to say thank you to the HWS team for taking the lead. We know that administratively this is a big count to put on, typically 750 or 1,000 or more volunteers. And I am guessing, but I know the impact report that's coming up may speak to this. I think we just wanted to second the support for the biennial format. And the weighting of other performance data that you have available to help us gather that broader snapshot. So I know sometimes that there's fears about biennial, but I think we wanted to voice some support for that format.
Thank you, Marcus. Any other board members?
Yes.
Okay, Karen, go ahead, please.
Yes, I wholeheartedly agree with Marcus. This is layered on top of everything that the HWS team has to do. And I wanted to just put this out there. I've mentioned it at Continuum of Care in terms of how we're framing the message for the results of the count and how we're communicating with our cities and the stakeholders. And as a board, I think we really need to weigh in on this. We should not just present the results of the count, but data from HMIS, which shows 100 times more information about the massive amount of people that are being served in an unduplicated fashion throughout our region. So I think sometimes the PIT numbers, especially the unsheltered count, give local jurisdictions a perspective that maybe they don't have as much of a need as they really do. So I hope we can be strategic about it. And HWS does a great job showing this in the high-level PIT summary, but I'm hoping we can drill it down a little bit more by city. So thank you.
Thank you, Karen. Do we have any public comments from remotely, virtually? Okay, do we have any members of the public present today that would like to address this item? Okay.
Actually, Madam Chair,
Yes.
If I could add on to what Karen was saying, is that we've been really deliberate over the last year and a half that when we meet with local jurisdictions or community partners and talk about the pit count, that we're also talking about that HMIS data and that what the real impact to the county is. And so I appreciate the comments, Karen, because that dialogue still does need to continue. I know that our team has talked a lot about when we do release that data, it's not only releasing the pit data, but HMIS data, and then also some really good positive data that we've seen where we actually rank both in the state and nationally as far as our percentage based on per capita and population of homelessness.
Thank you, Greg. Other comments? I do have a comment. I'm just wondering, Tanya, if you have any thoughts about the impact that the governor's executive order will have on the way you approach it this year, the kind of reaction you're going to get. How are you taking that into consideration?
So the governor's most recent executive order was to state, and just to give some background to everybody here, was to state departments, but certainly encouraging counties and cities to clear out encampments, but of course, using or doing that alongside a housing first approach where you're offering housing resources and services to residents. And in seeing what was put out in the media, which I think is what most of us read, and I certainly had a certain reaction to it, and then weeks later, being able to debrief with some of his staff, I really understood that the intent was really to move communities into action to do something, because, right, the fear or unfortunately, other communities are not as active in using state dollars for housing or allocating those resources efficiently in the way that we have done here, right? It seems like every other month we have a special meeting because we're getting together with you to try to make commitments to funding so that we can get projects started and housing resources on the ground so that we can move people into housing. So in regards to how the executive order will influence our point in time count, I feel very proud to say that in Riverside County, we've always been that community to do something. All of our agencies have been quick to scale up their programs, and our PIT count historically, as I mentioned earlier, has included 100% reach throughout our entire county, and so that emphasis will continue. And to speak more on sort of this call to do something, I think the other thing that I'm proud about is that we've submitted applications for additional competitive funding opportunities, which we've learned we are being considered for. And so I'm hoping that during the month of November, or during our next meeting in November, surprise, surprise, we'll be able to kind of share on those announcements that will allow us to do more. So hopefully that sheds some light on that.
Thank you, Tanya. Okay, this was an information item, so there's no action needed. We'll move on to the next item, 4.4, which is a Continuum of Care Impact Report, also an information item. We'll turn it over to Salam Walker.
Good morning, Board of Governance members. My name is Salam Walker.
Oh, you're good. I was asking Mariela if she could bump up the slides. I think she fast forwarded on.
Okay. Oh, it might have been me.
You are good.
Okay. Let's see. My name is, as I said, my name is Salam Walker. I'm the GIS Research Specialist 2 and Data Lead for Riverside County Continuum of Care. I'm excited to be here to present our Homeless Impact Report for the 2023-2024 fiscal year. Over the past few months, we've been working closely with our partner agencies to improve data quality as part of our ongoing efforts. This has been essential to make sure that the data report is not only accurate, but also truly reflects the incredible work our agencies have been doing. Thanks to this collective effort of our agency and agencies and partners, we finalized the data and we're very excited to share the results with you today. In my presentation, I'll go over the progress we made and the number of individuals we've assisted and households we've assisted who are experiencing homelessness. I'll highlight the impact of our programs. I'll also share the progress goals towards the goals outlined in our 5-year homeless action plan. Okay. So before we get started, I would like to highlight a key achievement that demonstrates our progress, our success of our collective efforts. Recently, we aim to better understand where Riverside County stands in terms of homelessness per capita. After analyzing the data, I'm happy to share that Riverside County currently has the lowest per capita homeless rate among all counties in the state, despite having one of the largest populations. This accomplishment is a testament to the effectiveness of our strategies and outstanding work by all of our agency partners, but also the full continuum of services being provided to develop affordable housing, expand access to healthcare, mental health, recovery treatment services, facilitating employment opportunities, and doing more in reach to people who are exiting our jail system. During this last fiscal year, we have provided over 30,000 services across 226 programs. These services reached 18,339 unduplicated individuals and over 14,000 households. This represents a 6% increase in the number of people we've been able to serve in comparison to last year, demonstrating the need for us to continue doing more. And by more, we need more housing, more services, and increasing our focus on housing first strategies. It is important to note the growth rate has declined compared to the previous year when we saw a 26% increase. In addition, we've secured housing for 5,711 individuals, bringing the total number of housed during this period to 7,307 individuals. These placements represent new move-ins and those who were placed into housing during the reporting period, prior to the reporting period, and are actively receiving housing services. This slide provides a breakdown of outcomes for each of our project types. Our street outreach teams have engaged with 6,038 individuals, meeting them where they are, providing case management by connecting them to the necessary services and pathways to housing. We have also seen a 4% increase in successful housing placement through this program, showing improved outcomes. So we thank you. We thank you for having your teams build housing case management plans as they engage people on the street. And the data shows it's working. Across our emergency shelter projects, 37% of the households were placed into permanent housing. In transitional housing project, we've assisted 1,145 individuals, and 79% of those who were exited were housed successfully. In our permanent supportive housing programs, we continue to see strong successes in exiting individuals to permanent housing. Permanent supportive housing project achieved a 96% success rate in moving new people into housing and keeping them housed. Our rapid rehousing project showed an 85% success rate, quickly stabilizing individuals in permanent homes, all while transitioning them off a subsidy so that they can ultimately absorb 100% of the rent. Lastly, our service-only program that provides case management, food, education services, mental health, and other supportive services without the housing component assisted 843 individuals. In our 5-year homeless action plan, we established a clear benchmark to track our progress across 6 key goals. Our first goal is to ensure that more people exit into housing each month than the number of people who become newly homeless. I'm proud to highlight that our outflow into permanent housing has exceeded the inflow of individuals entering homelessness, which is a critical measure of our success in reducing homelessness. Our second goal is to reduce the length of stay for individuals experiencing homelessness by 50%. So far, we've reduced the length of time it takes to connect individuals to housing by 24%. For the third goal, we aim to reduce the number of people experiencing unsheltered homelessness after discharge from jails or hospitals by 50%. We have made a great progress here with a 39% reduction this year. Our fourth goal is to increase the number of crisis beds by 25%. So far, we've increased our crisis bed capacity by 13%, which means we are on track to meet our goal. The fifth goal focuses on increasing the number of permanent housing units by 75%. We are currently on track to meet this goal with hundreds of units in production. Lastly, our sixth goal focused on reducing the number of people experiencing homelessness for the first time by 75%. While this goal is still in progress, we've only seen a 2% decrease, and we're continuing to focus on implementing preventative measures. This is going to be the hardest one to tackle, and it's simply because of our population size in Riverside County has doubled in the last decade and is expected to continue growing. Additionally, seniors are expected to, at a fastest pace of growing population in our region, and we'll need to remain aggressive in our approach to build more affordable housing to stop the inflow. That concludes my update. We want to thank you, our providers, the county departments, cities who continue to invest their own resources to respond to homelessness. I'm available to answer any questions. Thank you.
Thank you, Salam. That's very good information. Helps us understand. Okay, I'm going to open it up to our board members. Questions, comments on this presentation?
So maybe just a quick comment. First, want to say thank you. There was a time when we weren't really gathering data in this way and presenting it in reports where everybody could understand. And so really good job for you to do what you do and to share. I know public speaking is not your favorite thing, but you did a fantastic job in presenting and making and telling the story. I think one of the things that I would just add to this, I was going to bring this up later, but just kind of mention it now, is really on that last point around prevention. That might be the space where we don't really know how to capture all of what's going on when it comes to preventative strategies. So maybe conversation that this board can have at another time on what are those strategies that we know that are effective. You listed a few of them as you started. I tried to jot them down in my phone. But what are those things? Some of those things may be outside of the scope of sort of what we do here. But maybe we're, kind of sharing data with other partners who are doing that work so that we can see the progress that we're making towards number 6. But just great report. The numbers are fantastic of what's going on and why Riverside County is a leader, not just in the state, but in the nation, of everybody looking at that homeless action plan and trying to compare what they're doing to what we're doing here. So glad to be a part of it.
Thank you, Dr. Johnson. Karen, do you have any comments, questions?
Yes, Madam Chair, really a comment and a question. I'm very happy to hear about the continued focus and need on seniors. We do have an age tsunami upon us, and want to give credit to our partners with APS and how we can work together to try to get seniors placed in housing faster. And I wanted to ask just a follow-up question on, I believe our vouchers, just because of the funding and the allocation and the amount of the rents that we're paying in this region, I think we still have a freeze. And I wanted to ask that question, if APS, if we still have a freeze and they're not able to make referrals for Section 8 vouchers, and what we expect in terms of the timeline for that. I know it's a funding thing and we have high rents, but I'm just curious how we're doing, because that's such an important piece for such a vulnerable population in our region.
Karen, if you could pause on your second point, and we'll give Tanya or Greg or Mike opportunity to address the first part.
Good morning. Mike Walsh, Assistant Director, Riverside County HWS. On the voucher front, yes, we're still in a pause on new vouchers. We are working with HUD on that. We hope to have that resolved by the end of the year so we could restart in the spring of next year. That said, we're still doing project-based voucher releases. So if we have a number of new apartment complexes opening up that have vouchers, like one here in the city of Murrieta, Monomus Apartments, should be opening up. I saw Brian earlier, like hopefully in the spring. That would be 8 project-based vouchered units, but overall 140 units that are opening up here in the city of Murrieta. Do a full plug for the city of Murrieta. They're doing a lot of really great things on housing, and we were just talking about there's probably close to 1,000 affordable housing units that they have in their pipeline here that should be starting sometime or finishing over the next 18 months. So congratulations to the city. But yes, so on just the straight voucher front, there is a pause. But where we are trying to connect with our wider team and outreach is making sure folks are aware of just general affordable housing units that maybe seniors and others get access to, where they don't necessarily need a voucher, but they can find a unit that they can afford. So really great work by Salam, and I just want to place a plug that this is just one of the avenues where we're presenting this information. Now that we have this data, we want to make sure that it's socialized as part of PIT outreach and information, as was mentioned earlier, in the full context. And really, without people like Salam to actually do the analysis on this, we wouldn't have this. So really huge credit to the COC team, and that you're going to be seeing more about this and using also visuals and stories to really get the information on the quality work that's happening in Riverside County.
Thank you, Mike. Karen, do you have any additional questions, comments?
No, I think if I understood what Mike was trying to say, the referrals coming from APS for vouchers for seniors are on pause for now. So I think that's what he said, and I appreciate. Thanks, Mike.
Yes, he said yes. Okay. Do we have any comments from any virtual comments, public comments on this item? No? How about in person? Do we have any members of the public that would like to speak on this item? Okay, no? Okay, so I just have a comment is, again, I think this is great to be able to have this kind of information and to be able to tell the story of the numbers. We're going to do another point in time count, and sometimes people saying, well, what's going on? The numbers are either increasing or they're staying the same after all the resources we're putting into it. So this is telling the story of what is really happening behind the scenes. So that is great work. My question is, when we look at the data of determining how long people are staying housed, what is the period that you're looking? Do you check back like a year later to see, is it 3 years? Okay.
Yeah. So we've done a 3-year analysis, and our numbers point to over 80% are maintaining that housing.
Okay, great. Thank you, Tanya. Thank you, Salam. Great work.
Thank you.
Okay, next we will move on to the next item, 5.0, which are announcements. And I'm going to start off with 5.1, and then I will ask board members if you have any of your own. But the longest night, which is December 19th, Tanya, can you tell us what's going to happen?
It will be Gershom from our team, and I'm excited that he's here today to share what's happening.
Good morning, board members and members of the public. My name is Gershom Hiron, and I serve as the Homeless Youth Coordinator for the County of Riverside Continuum of Care. It's a pleasure to be here today and to announce our upcoming Longest Night of the Year event, or also known as Homeless Persons Memorial Day, which is held during the winter solstice to commemorate those who have lost their lives while experiencing homelessness out on the street. So our event is scheduled to take place on Thursday, December 19th at Fairmount Park in Riverside. So on behalf of the COC, I would just like to express gratitude to the City of Riverside for once again allowing us to utilize their venue for this event. And this event will initiate at 5 p.m. With a resource fair dedicated to providing the services that are mainly needed for some of our unsheltered neighbors in the area. And so we aim to build upon the same momentum as last year, where we had a great turnout and where it really was a meaningful event for our community. So in doing so, we have reached out to some of the same service providers as last year who really played a pivotal role in ensuring that last year's event was a great one. So I would just like to give a special thanks to RUHS, DPSS, Animal Services, and Healthcare in Action, and all the other agencies who made last year's event memorable. And so I would also just like to emphasize that this is a community event, so we do encourage everyone to attend. We encourage you to bring your family, your friends, your loved ones, and to help us commemorate and honor those who have lost their lives while experiencing homelessness on the streets of our community. And I would just like to finish off by saying that if you are a community partner who is interested in providing services at one of our future Longest Night events, I recommend that you email us at coc@rivco.org, and we will be sure to include you on all of our planning committee meetings, which usually begin sometime between March and April. But with that, thank you for your time.
Thank you. Any questions, comments from board members on this item? Okay, members of the public, anybody have any questions on this item? Okay, I do have a comment on this. I think it's great that this is an annual event and that it is growing, but I really hope that you will at some point consider doing some satellite ones so that people don't have to travel from Murrieta to Riverside or Indio to Riverside. So hopefully that's, okay, good.
Yeah, and I'm the wrong person to give the detail, but I can I can give very brief. We did an event in Indio last year as well as in Hemet, and there are plans to repeat those this year. Same day as well, but again, I don't have all the details, Letty, but there will be satellite events, and we'll share out those specific details as they're
so there'll be an event. We've had one meeting with Marcus's team, and there will be an event at the Hemet Clinic again, similar to last year, a smaller, more intimate event. They prefer that there. And the team was working on setting up a larger event in the desert, but I don't have the site information just yet or the flyer. But we will be meeting in the coming weeks to finalize those details. But this for Riverside has already been finalized.
Very good. Thank you so much for that good news. Okay, so any other announcements from board members? Oh, Greg, we'll start with you. And then I'll go to you, Karen, next, okay?
I just wanted to highlight that that we did a ribbon cutting on Monday of the Palm Springs Navigation Center. A significant investment in that community of about $40 million in combination of funds from the American Recovery Plan Act, significant allocations from the county of $15 million in various pots of dollars, including a shout out to IEHP and Molina on the Housing and Homeless Incentive Program dollars. It's one-of-a-kind, state-of-the-art facility that has access to shelter, and then 80 transitional housing units for families, for individuals set aside for transitional age youth, and full wraparound services, workforce development initiatives on site as well. So very happy that that is open, as it's been a little bit a project of mine, and a shout out to Hutch and the police department too for the partnership, as well as their fire and the city. You know, a short time ago, there wasn't a close relationship between the city and Palm Springs and the county on homeless services, and that has completely changed. The partnership is incredible, and we really believe, as Supervisor Perez said on the dais on Tuesday, is that this really is a model for not only the rest of the county, but as well as the rest of the state as well.
Great work. Thank you. Thank you. Karen?
Yes, Madam Chair, thank you. First, just a comment to Emma. Feel free to sign me up for the longest night to be a reader. That is like such an amazing experience. And if others haven't done it, I encourage you to consider it. So if it's not too late, Emma, feel free to sign me up for that. And then also, just putting my Chair of the Continuum of Care hat on, I wanted you all to know that even though the Continuum of Care meetings are remote, once a year we do an in-person meeting, and we're going to do that again. And the City of Corona is going to host lunch for everybody. And that in-person meeting is November the 20th, and the Continuum of Care meetings start at 3 o'clock. I do encourage our Board of Governance members to think about joining us. It's really a beautiful opportunity to get together with the larger Continuum of Care, break bread. We're going to have some acknowledgements and play some fun games that relate back to the Continuum of Care. So we'll have more information that will go out, but that's the November 20th Continuum of Care meeting that starts at 3 p.m. And I sure hope all of you or some of you would consider coming. Thank you so much.
Thank you, Karen. Any other board members have any announcements? Okay, we will move on to the next item, which is 6.0, call for agenda items for the next meeting. Do we have any board members that have any agenda items that they would like to request? Okay.
I'll throw one out there, just following what Carol brought up as far as, we've talked about this before, but maybe creating the incubator program for smaller agencies to prepare them to go after funding. So something that is just more formal. Let's talk about what that would look like. And maybe there's steps to that of becoming a partner, then preparing for funding. So maybe it's sort of a tiered process, but an incubator program. Second one that of just bringing up, maybe this is next meeting or after that, is sort of rallying the faith-based partners that we have. That was mentioned today, certainly as part of the larger action plan. But how do we get faith-based entities more engaged, that maybe they're not receiving funding, but they're supporting the funded partners? And if we could pull that together regionally. And then the last part was on prevention strategies that I mentioned before around the data.
Excellent ideas. Karen, do you have any ideas, any requests for future agenda?
Just what I had mentioned, and Tanya confirmed that if we can have a focus on the performance metrics, which she had mentioned, I think would be wonderful, that are attached to what we transmit to HUD for our regional application.
Very good. Thank you, Karen. Any other? Okay, we will move on to the next agenda item, which is 7.0, the next meeting. The next regularly scheduled meeting will be on Thursday, December 12th, from 9 to 11 in the city of Banning. Additionally, we will be reaching out to schedule a special meeting in November. Tanya, do you want to talk on that?
Just that we have two funding opportunities that are currently open to the community. And so as has been our practice, we want to get those resources out into the community as quickly as possible. So we appreciate the board, our Continuum of Care, and of course, the agencies that are preparing their proposals as we speak for those two funding opportunities. And because of the timeline right when our application is due. I think in one case it's to HUD, in the other case it's to HCD, the state's Housing Community Development Agency. We need to meet prior to our December meeting to meet each respective timeline. So we'll be in touch with you. We appreciate you, and I'm available if anybody has any questions. But it's our HUD Continuum of Care Builds NOFO, which funds development of new permanent supportive housing projects, which we're really excited about, and then the state's Homeless Housing Assistance Program, or HAP Round 4, which I talked about earlier, which is a $4 million investment of resources we already have, and we are looking for local vendors to help us carry out that local vision. So thank you.
Thank you, Tanya, for that explanation, and we look forward to those topics in the future meetings. Next, we have 8.0, adjournment. If there are any other, yes, go ahead.
We have a request to make a public comment from Renee Huckstead.
Okay, I'm sorry for skipping that. I apologize, and please proceed.
Oh, I'm sorry. I was a little multitasking. A couple of calls came through, but I am remiss to let you guys know that HSP did receive the Housing Support Program. For those of you who don't know the 10,000 acronyms that we have, has received a little bit more money, a little bit more funding this fiscal year. So I wanted to let the board as well as the COC know that we received an additional 1.2 million. So we have about 8 million to spend this year through that program, with funds ending or going back into the pot at the end of this fiscal year. So part of my duties is to inform everyone. So thank you, Madam Chair. I apologize for jumping in.
Renee, can you briefly, maybe describe HSP, so what those resources can be used for?
Tanya, yes, of course. I know we have so many fundings and different elements that come into play, right? So the Housing Support Program is for those families who are receiving CalWORKs. So that's that Cash Aid, Medi-Cal, CalFresh benefits for families, and they have to be active, but we could provide rapid rehousing services to those families who receive CalWORKs and are approved for the Housing Support Program afterwards. And they get rapid rehousing assistance, subsidies, temporary shelter while they're in our program, so we can get them fully housed. Again, rapid rehousing, so it's not long term. A lot of our recipients get up to 6 months, maybe a little bit less, maybe a little bit more, just so we can figure out what barriers they're having at the time. So just a quick overview of the program for you guys.
Thank you so much, and we do not mind extending the meeting to learn good information and resources and good announcements. So thank you very much for stopping me. If there are any other comments from our board members? No? Okay, then we are going to adjourn at 11:45. Thank you. Have a great day.
Thank you, Letty.
Thank you, City of Marietta.